My name is Paula, and I'm a patient here at PRMA, a patient of Dr. Chrysopoulos, and I'm 52 years old, and in April 2013 I was diagnosed with breast cancer. I'm married, and my husband has been wonderful and walked with me every step of the way of this journey. He's been my rock. So every doctor appointment, every test we went for, he was right there with me, which is very important. Every cancer is different. I've learned that no two cases are alike, no two women are alike. My case is unique because I also suffer from a chronic autoimmune disease called lupus. And I had already been adjusted to a new way of normal for many years now, but when the cancer diagnosis came, I was just shocked. I thought, lupus and cancer, this just can't be happening. My cancer was discovered by routine mammogram, yearly mammogram. I went as usual, and a few days later got the letter from the imaging center, opened it up, just expecting to file it away, and I remember seeing the words area of concern, and my heart sank. I couldn't believe it. I just thought maybe they got my files mixed up. But I went ahead and I went for a second diagnostic mammogram, and the radiologist called me in and he showed me the image of my breast, and it looked like a blue blob with a lot of white spots running through it, and that scared me. But he pointed out a fine squiggly line and described these areas as microcalcifications, and I had never heard of such a thing. And he said that particular type of cancer they're looking at or suspect is called DCIS, ductal carcinoma in situ or in sight. I was surprised. He described it as tiny sand-like particles, and so I felt relieved hearing the word tiny and particles and not huge lump or mass. But a biopsy was required in order to determine if it was cancer. So 2 days later, I'm lying face down on a table in the most awkward position, undergoing 2 what they call stereotactic needle core biopsies. A few days later, I called my doctor as instructed for the results, and I was told I had to come into his office because the results were not normal. Well, I knew at that point what I was looking at, and it was scary. A girlfriend of mine took me to the doctor because I just didn't want to go alone, and I heard the words, "You have breast cancer," for the first time, April 29th, 2013. I was shocked, I was numb, I didn't react, I didn't cry, I didn't scream. It was just really strange. My girlfriend reacted more than I did. I just went into businesswoman mode and thought to myself, okay, well, what's next? Let's do this. I got home, immediately called a friend of mine, a breast cancer survivor, and shared the news, was able to vent, and she gave me some very good advice, and she also gave me the name of her doctors, oncologist and an oncology surgeon. It was very important to me to go to someone who I knew was going to take good care of me and who I had been highly recommended to. Before that, I did go to my rheumatologist who treats my lupus. I informed him of the situation, and he assured me that he would take good care of me. He'd known me 20 years. I was strong. I am a fighter. He knew I would make it, and he would work very closely with all of the doctors involved. First trip to the oncologist was very strange. I walked in there and still was at the point where I felt like I didn't belong. I don't belong here. And you see people with cancer dealing with very difficult situations, going through chemo, going through radiation, not knowing at that point, will that be me? What am I looking at here? There's so many unknowns. I really just wanted to run away. But the visit with the doctor went very well. She was very nice, very educated, very informative. She explained my type of cancer. I understood it a little bit better. She explained it most likely had not spread, so hopefully I would not need chemotherapy, but I would have to be on a cancer treatment drug called tamoxifen for 5 years because my cancer was what they call hormone receptor positive. Next, I went to the oncology surgeon, and he went over my results and he explained my options. And long story short, we walked out of there knowing that I was going to be getting a mastectomy, a full mastectomy to remove the affected breast. And that was a shock, because all of a sudden what happened to the tiny little sand-like particles? You know, it was all of a sudden a huge monster, and my entire breast had to be removed. He did discuss options as far as reconstruction, and said he wanted me to go for a consult at PRMA, a reconstruction center here in San Antonio. And I remember thinking, why bother? Reconstruction, I don't want implants. It's too dangerous, I feel, with my lupus. Why bother? And I'll go get a nice mastectomy bra and just live my life the best I can. But he encouraged me to go talk to Dr. Crisopolo here at PRMA. He said there are different options besides the implants that may be safer for me and that I may be able to look into. So my husband was very encouraged. He liked the doctor a lot, and he said, why don't we just go check it out? I agreed, but I admit I was skeptical. With my lupus and all, any type of major surgery is very scary. So the next appointment was PRMA. In 2013 May, I walked through the doors of PRMA at the first time. I went and sat in the new patient chairs, and the videos were on, and it was women just like me who were sharing their stories and their experience with Dr. Crisopolo. And honestly, that was the first time I shed a tear throughout this whole journey. I sat there and I listened to those women, and reality sank in that, oh my gosh, I have breast cancer. I was shaken up emotionally by the time we got into the appointment. But Dr. Crisopolo came in with his nurse Denise, and just from the beginning they were warm and friendly. We went through the typical doctor-patient interview and went over my medical history, talked about my lupus. He talked about what he thought would be best for me, which is called a DIEP flap procedure, where they take tissue from your tummy and transfer it to make the breast mound where the breast tissue has been removed immediately after reconstruction. My head was still spinning at this point, and he sat down and he pulled his chair up close to mine, and he looked me straight in the eyes, and he said, so Paula, how are you doing? How are you doing with all of this? And not many doctors take the time to ask about how you're doing. You know, he was giving me the opportunity to vent, really. He sat back, he listened. I had so many questions, I had so many concerns. And then when I was finished, he talked to me about the lupus. He had had experience with lupus patients. He would run specialized blood work on me prior to even approving me as a candidate for the surgery, all in regards to lupus and healing, and if it would even be possible to go through such a complicated surgery. He answered every question. He made me feel comfortable. I felt very at ease, and most of all, I felt that I could trust this man with my life. My surgery, the DIEP flap reconstruction, was June 17th of 2013. I stayed in the hospital for a week, and I was given the very good intensive care that I needed. Recovery went well. I did not have any lupus complications at all. And before I knew it, I was back 6 months later for phase 2 of my surgery, the reconstruction revision part, and that was in December, and everything went well. I'm very pleased with my new breast and with the results thus far. I am in the process now where phase 3, where they do the artwork, will be in March, in a couple of months. Everyone here at PRMA is incredible. The whole staff is wonderful. They realize that patients go through a difficult time, not only physically but emotionally. They care for your emotional needs and your spiritual needs. There are monthly follow-up support groups, the Pink Ladies, where it's not just sitting around and crying about cancer. I mean, we do come and we vent, but there's always information about nutrition, education, ways to cope. It's uplifting, and it's a very safe place to be. And so now I sit here today sharing my testimony, and I'm very proud to say that I am a Pink Lady. But I couldn't have done it without a wonderful support team, friends, family, loved ones, many prayers, and especially the support and care from PRMA.